Good afternoon and welcome to this Hero Learning Series webinar, Character Strengths Can Help Your Health, Evidence from Longitudinal Survey Data and Medical Records, featuring one of the winners of the 2021 Paper of the Year Award from the American Journal of Health Promotion. I'm Karen Mosley, President and CEO at Hero, and typically Dr. Paul Terry would be here to congratulate today's presenter. But as Hero Senior Fellow in charge of our recent Hero Forum, he's taking some much deserved time off. Most of you know that Paul is also the editor-in-chief for the American Journal of Health Promotion, and Hero is always pleased to introduce authors of the journal's Paper of the Year Award through this Hero Learning Series. The goal of the Paper of the Year Awards is to honor some of health promotion's best scientists, and especially to recognize those who bring outstanding humanity to their field of inquiry and big-heartedness to their writing. And you'll quickly see both qualities in today's presenter. It is my honor to introduce Dr. Dorota Weziak-Bialowolska. When notified of her selection, she was quick to express gratitude for her colleagues at Harvard and the SHINE Initiative, all familiar connections in Hero's research over the past several years. Dorota is an associate professor at the Jagiellonian University in Krakow, Poland, and research affiliate at the Human Flourishing Program, Harvard University. Previously, she held positions as a research scientist at the Harvard T.H. Chan School of Public Health, a postdoctoral researcher and a research fellow for the European Commission Joint Research Center in Italy, assistant professor at the Educational Research Institute in Poland, and an assistant professor and research and teaching assistant at the Warsaw School of Economics in Poland. In her career, Dorota has had an opportunity to work with policymakers, international organizations, foundations, and nonprofit international organizations on multiple interdisciplinary projects. She also served as a scientific advisor for the European Foundation for the Improvement of Living and Working Conditions in the Quality of Life in Major European Cities project. To date, she has published more than 80 papers in peer-reviewed journals, 7 book chapters, and 2 books. Dorota received her master's degree in quantitative methods, her doctoral degree in economics, and postdoctoral degree in sociology. Dorota, welcome. I'm looking forward to your presentation, and then we'll open the floor for Q&A with our webinar attendees. And to our attendees, please use the Q&A function to submit your questions throughout the presentation. So Dorota in Poland, I'll turn it over to you.
Thank you so much, Karen. It's a great honor to be here and to have this opportunity to share with you my research and the research of my colleagues, because what I'm going to present is a collaborative effort which has been last for at least 5 years, during which Human Flourishing Program and SHINE at Harvard School of Public Health collaborate to improve employee well-being. And today I'm going to talk about the role of character strength for health. Let me start that this research, it doesn't work somehow, okay, has been conducted with a lot of organizations and companies with whom or which we collaborated so far. And as you can see, there were Levi Strauss Foundation, Target, Aetna, Kohler, Owens Corning, Aduro, but also organizations such as World Bank and International Labour Organization and YMCA and many others too. And while working with them, we've always focus on these relationships which exist between individual well-being or individual flourishing and successful organizations. So it was always important for us to start talking with our partners, stressing that it's not only about companies, but it's especially about human beings. And while talking with them, about these links, we've also found in the research and in the literature support, we found that we are not alone, and actually there is already a strong business case which is aligned with this persuasive humanitarian argument that it's important to create caring organizations that meet fundamental human needs. And actually, there is always also a social movement in the business sector. It's known as humanistic management, which underlines again ethical caring and promotion of human well-being, and indicates that these factors are crucial for healthy management practices, but also for talent recruitment and retention. In our research, we looked at human flourishing or complete well-being very broadly. It's not only about hedonic well-being, which is reflected in happiness and life satisfaction. It's also eudaimonic well-being, which is reflected in meaning and purpose in life. But it's also well-being. It's also about health, physical and mental health. It's about social connectedness. It's about character strength, and it's about financial security. And actually, this concept was proposed by one of my co-authors, Professor Tyler van der Wiele, in his paper on the promotion of human flourishing. And under his guidance, or it was his initiative to set up, to develop a measure, which we did. It's a human flourishing index, which was validated and published. But what I would like to stress that our view on well-being actually is in line with the health definition by WHO, which states that health goes beyond the absence of disease. It's a state of complete physical, social, and emotional or mental well-being. We are also not alone in this type of thinking or broad thinking about well-being and well-being while at work. And probably you are well aware that for example, the Total Worker Health Program was launched, or initiative was launched by the American Sociological Association together with CDC and NIOSH. So the world is changing, and we looked at well-being very broadly, and it's not only about health, it's not only about happiness, but it's also about character strength. And this is the main actually focus of this presentation. And as Karen introduced, we were very honored to be included in the best of 2021 list of health promotion research. And this paper I'm going to talk more about was about examining prospective or longitudinal associations between character strength and well-being and health. Let me explain a little bit how we understand character strength. These are personality traits. These are positive personality traits which have a moral valence. And they are already known to be fundamental to person's identity. They are known to produce positive outcomes for ourselves and for others. And they play an important role in both shielding against the adversities in life and enhancing impacts of positives in life. And actually, it's not a new idea, because even since antiquity, we know moral philosophers and religious thinkers and also scholars, they indicated that acting in accordance with virtue and having an excellent character reflected in engagement in good deeds and affirmation for integrity and moral behavior were crucial to attain the state of complete well-being. So we followed this reasoning in our research, and we actually looked into one particular aspect of character strength, which was named an orientation to promote good in all circumstances, even in difficult and challenging situations. And we asked respondents how much they agree with this statement. And then we examined how this agreeability was associated with various health and well-being outcomes. And actually, we examined 28 health and well-being outcomes quite a lot. In this case, we applied an outcome-wide analysis. That's why we looked into various outcomes, because it's been shown that it's easier to discern a pattern of associations when you have a set of outcomes compared to the situation when single outcomes are examined in single studies. So we looked into a set of emotional well-being outcomes, such as life satisfaction, happiness, self-assessment of mental health. These indicators were expressed or formulated in different ways to limit the risk of the impact of the wording of questions. We also looked into physical well-being outcomes, for example, self-assessment of physical health, but also information about feeling pain or feeling physically well. We looked into purpose in life and also social connectedness, because these factors are well-known determinants of longevity, of lower risk of cardiovascular disease, and many other important health outcomes. But we also looked into outcomes related to our work life. And in particular, we examined affective well-being while at work. So we asked respondents how they felt at work yesterday or the last day they worked. And we looked in particular into feeling happy, energetic, close to people, trustful, sad, depressed, stressed, and lonely. We use data from 2 longitudinal observational studies from 2 culturally different populations of working adults. The first one was a large service organization based in the US, and we examined more than 1,000 employees. We were there in 1 year, and then we came back 1 year later. And the second population were working adults from a Mexican apparel company in the supply chain of a major global brand. And in this case, we used 3 waves of data. So we came back there twice, at the baseline, and then 1 and the 2 years later. And as you can see, these populations were quite different. The first one, in the first one, the percentage of women was quite high, while the second one was more balanced in terms of gender. The first one was older compared to the second one, and they were definitely different in terms of ethnicity or race. And what we found using these two data sets, as I said, we examined associations between promoting good and a 1 year after outcomes. So from our research, we concluded that promoting good was associated positively with happiness and life satisfaction, self-assessment of physical and mental health, purpose in life, social connectedness, and negatively associated with self-examined, self-assessed depression, anxiety, and loneliness. There were also associations between these outcomes while at work, and they were as follows. We found that promoting good was associated at a 1 year follow-up again with feeling happy at work. This was a positive association, and negatively. So the more promoting good, the less feeling sad at work, less feeling stressed at work, and less feeling lonely at work. No effects were found for feeling energetic, close to people, trustful, and depressed while at work. Quite interesting findings for us, both this while at work and in general. But this study I've described used self-assessed health outcomes. So our following step was to look into more objective health data, and we had this opportunity to merge the survey we conducted with medical records. In particular, we got access to healthcare insurance records from which we derived information on clinically diagnosed depression, clinically diagnosed anxiety, and clinically diagnosed cardiovascular disease. And we found that various aspects in this time of character strength were associated with these health outcomes. We looked into moral compass, which was measured by a statement, I always know the right thing to do. We looked at promoting good, and we looked at kindness. And for these three dimensions of character strength, we found quite substantial associations at the one-year follow-up with clinically diagnosed depression. This association indicated that the odds of being diagnosed with depression were at least 20 to almost 40% lower. For delayed gratification, another aspect of character strength we looked at, using a statement, I'm always able to give up some happiness now for greater happiness later, we found associations with 20% lower odds of clinically diagnosed anxiety and almost 30% lower odds of clinically diagnosed depression. And finally, we looked at use of character strength, because it's slightly different thing, use of character strength to help others. And here also there were associations with lower odds of depression, it was 38%, and 61% lower odds of cardiovascular disease. Though I need to mention that this last finding was not so robust because the confidence interval was quite wide. But this brings me to a very special case, I would say, optimal use of character strength, because we already know there is emerging evidence that application or use of character strength does not necessarily imply positive health effects. Actually, we have some evidence that the character strengths of appreciation of beauty, humor, perseverance, and social intelligence are associated with an increased concurrent risk of smoking and excessive drinking. I'm not saying there is a causal relationship. There is an association which could be indicative of some negative contribution, but it informs us that there could be imbalances or suboptimal use of character strength. Each character strength actually can be used too much or too little, and the same reasoning applies to character strength use. So the association relationship with other health outcomes can be nonlinear. It could be positive, but it could also be negative. For example, let's think about an overuse of kindness. It's reflected in being overly focused on others and thus neglecting self-care and self-compassion. And this can make us feel overextended, drained, and compassion fatigue. That's why it's so important to optimally use character strength. And although our research was conducted in the workplace setting, we, as you noticed, we used well-being related work outcomes. We didn't look in particular in this study into classical health work outcomes such as job satisfaction, for example, or work engagement. But we know from prior research that there is such an association, or even we can start talking about relationship, because there are prior studies which are experimental studies which can tell us a little bit more about the mechanisms and causal effects. And actually, we know that an application of mindfulness-based character strength exercises can be beneficial for better task performance and greater job satisfaction. Another example, an application of signature character strengths. Signature character strengths are those strengths which we have the most, or the strength that rank the top in our profile of character strength. These strengths were found to be associated with a subsequent increase in job satisfaction, work engagement, but also meaning fostered by one's job and social moral climate at work. And finally, the use or application of character strength of fairness, honesty, judgment, and love was indicated as being beneficial for psychological well-being and work engagement. This study concerned in particular hospital physicians. So there is a question what we can do to maybe enhance character strength in a workplace setting. Here I present two examples. It was found that supervisor support, but not necessarily a support from colleagues, on a given day was associated with an increased character strength used on the following day. And also social moral climate at work was shown to improve the applicability of signature strength even 6 months later. So what does it tell us? We observe nowadays an increase in the number of chronic disease. We know that the number of people suffering and feeling lonely is increasing, that the burnout and stress are at all-time highs across professions. And this all has been putting a huge burden on us humans, but also on the healthcare systems. So if an application of character strength do enhance health and well-being and consequently affect the healthcare use, our findings, our research, this type of research could be used to inform new strategies for preventive healthcare screenings, lowering emergency room use and healthcare costs. And actually, we ended our research and our article, our paper, with this statement that character strength, for example, an orientation to promote good, but also others, may be considered relevant for population mental health, also for physical health, but there is more evidence for mental health, and also well-being while at work. And public health policies, which will promote character strength and their application or use, are likely to receive positive reception from the general public because they seem to be aligned with the nearly universal human desire to become a better person. And this brings me to the end of this short presentation. Thank you so much.
Thank you so much, Dorota. It's just fascinating. And I can tell you that these are similar to discussions that we've been having at Hero. And so while we're waiting for questions to come from our attendees, I do have one to get us kicked off. We appreciate when researchers are able to connect science and practice, and you've provided some actionable steps, both for individuals and well-being practitioners in the study. Are there any practices related to spiritual well-being that employers might want to consider within the context of your research?
Yeah, thank you. Yes, there are, but I think it's good to start with this statement that we are different as human beings and we have different character strengths. And actually, I think there is no one-fit-all solution, because it's important to first establish which character strength for which job first. And also it's important to identify the strength we have and we can use. What is already known, it's more important to apply or to use the character strength than to only possess them. So I believe it's important to create awareness for individual character strength. And also what we can do as employers, for example, we can create an environment and climate for their application. And this brings me to this topic of climate or culture, organizational climate, organizational culture. And we have some evidence that caring culture, compassionate climate, or social moral climate are conducive to creating this environment of feeling better and of application character strength. And by saying this caring, compassionate, or social moral climate. I mean the situation in which there are interactions at workplace which are appreciative, participative, recognizing efforts, when there are elements of trust, respect at work, when we care for ourselves.
I love that. And I think it's a great example and application of what we've learned when we have some recent studies on the data and responses to the HERO scorecard, the HERO Health and Wellbeing Best Practices scorecard in collaboration with Mercer. And the most recent study from that work shows that organizational and leadership support are the strongest predictor of better financial outcomes, health and medical costs, participation in programs, and employee perception of organizational support. So I think you're right in line with what we're finding at HERO, and it's a great example of applying it. So Dorota, HERO members participated in our summer think tank earlier this year that asked the question, what place for the workplace in supporting social connectedness, spirituality, faith, and purpose? Based on your research, how would you answer that question?
Oh, this is a very important role. I would say there is a very important role of workplaces and employers, and we can even say, I would call it responsibility, because as you said, support from supervisors, supportive environment in general has been already shown to be beneficial for better economic outcomes, for better individual work outcomes, but also for our own well-being. And actually, we conducted a study which showed us that, for example, feeling purpose at work is associated in time with feeling purpose in life. So what we do at work contributes to how we feel in life. And I will say it again, because it's a very strong message. Purpose in life and meaning in life. We have plenty evidence showing that when we have these feelings and these experiences, we are very likely to live longer. And the risk of having a heart attack or a stroke is substantially lower. So if there is a way at work that we can improve our purpose in life while working, why not to use it, right?
Absolutely. You know, coincidentally, I was attending the virtual action forum hosted by the Foundation for Social Connection. It's going on this week, and I listened to a presentation from your research colleague, Tyler van der Wiele, along with others on religion and spirituality and how to be respectful of individual preferences for religion or not, and making sure that you know you have that basic understanding before pursuing a more in-depth conversation about spirituality and the connection to purpose. It was fascinating. So I commend anyone to go find the Foundation for Social Connection Action Forum that continues through until tomorrow. Well, Dorota, this has been an extreme pleasure. I know it's getting late in the day / evening for you. Are there any other final thoughts that you want to leave us with before we close?
Actually, I would like to share that I got interested in this type of research because of my personal experiences. And at a certain moment of my life, I started looking into positives because, you know, before I did research on how harmful something is. And at a certain moment, I thought, okay, let's shift it. Why should I feel so bad? Maybe we can find some positive health resources which can help us to feel better. And I found it, among others, into character strength, and I'm so happy about it.
We're so happy about it also, and so happy that you were willing to share your research with us. We will be paying close attention to what's coming next. Do you want to share any research that you're currently working on that we should be on the lookout for?
So together with Tyler Vanderwill and the Global Flourishing Study, we're going to collect a lot of data in more than 20 countries, and it's a collaboration with Gallup and other institutions. And we will examine various topics longitudinally, but we will also look into the role of character strength. And because so now we know that the effects last at most a year, but the data, the new data will come and will be coming for the next 5 years. So you should look for new evidence about maybe, probably, hopefully longer lasting effects.
Terrific. We look forward to following that and bringing you back for an update when that research is published.
I'm happy to do so.
Thanks again. And thanks to everyone who joined us for this Hero Learning Series webinar. As you exit the webinar, please do give us your thoughts on the exit survey. And until next time, we are adjourned. Thanks again.
Thank you.